When you get a disease like MS, it's very expensive. It requires a different way of thinking about money, and it requires a different way of thinking about savings.
MS has impacted our financial future. The stress of full-time work and just the exhaustion of it all was too much. And so it has impacted us financially to lose a half of a salary.
Clearly, one of the biggest ways that MS can affect finances is the potential loss of income or reduction in income for a household. Additionally, there could be increased medical expenses.
Our financial planning is surrounded, not exclusively, but a lot around this MS and what we have to do to prepare for something that might happen.
Finances affect people in many different ways. Having an understanding of their current financial picture really can give people peace of mind about where they are and where they want to be in the future.
I mean, suddenly we, are one income family.
Now I'm receiving a long-term disability payment each month, and it's nice to have that income, but I would much prefer to earn it the way I choose.
Take an inventory of all your resources and have that put together in a place that you can easily access should you need that information later on.
What actually we know in terms of research that's been done is that oftentimes people with MS are leaving the workforce prematurely and leaving the workforce voluntarily. Oftentimes people don't reach out to resources or don't consider their employment concerns until they are facing an employment crisis. Get educated, get informed, think proactively about how I can continue to work for as long as I choose to.
There are a number of employer-provided benefits that a couple living with MS should explore, such as health insurance, short and long-term disability, retirement plans, as well as potentially long-term care insurance.
You've got to make sure that you've got some kind of plan to cover those kind of medications and hospital visits and the rest. So
we just got long-term care insurance, and this is something that I've felt strongly about, and it is difficult to have that extra payment, but it's just an incredible peace of mind for me to know that we have that.
Marcia doesn't qualify for any kind of long-term care coverage. With MS just knocks that out.
And I have no disability coverage.
But so we have to make sure I have it.
I think that it is important to know your benefits, both as a person with MS as well as for your support partner, just to know what options do you have.
Flexible health care accounts, and kind of managing a lot of those day-to-day financial planning things to make sure that Sally has resources available to support her if she is having challenging symptoms.
Perhaps bringing in a third party, a financial counselor, will help them to really have a practical discussion about where they are and where they would like to be.
We have a financial advisor, and we've gone back and done some estate planning and trust planning and different things like that. But I think the MS prompted us to be a little bit more proactive in that space.
The MS Society offers financial planning. And so for anybody who has MS and needs to talk to somebody about financial planning, you can do it with the MS Society, and they are incredibly helpful.
And I also listened to my gut. I mean, it kept asking me to do more planning, and it was very much a peace of mind issue for me.
When discussing financial planning, it's important to keep the emotion out of it and maintain a practical, objective approach.
Really keeping that dialogue open with each other is critical in really trying to think proactively and planning ahead in regard to your employment situation.
We've tried to plan our life around knowing that we have to have funds to cover her medication.
Exactly. You know, in a chronic illness, you have to step back and say, where are my dollars truly being, spent. Where do I spend my money? What's the wise thing to do?
It's very expensive, and I guess the point I want to make is you plan your finances the best way you can based on your situation.